Welcome to the ACEs for Autism Lunch and Learn series. Join us for a 50-minute journey of knowledge and information. Also, explore a new facility through an immersive virtual tour. Looking for new career opportunities? Discover possibilities by visiting our website now. Don't forget to claim your free CEU upon completion of this recording. We are so glad you're here, and let's unlock potential together.
I am Marci Cochran. I'm a MSW, an LCSW, and an LCAS. And we are going to be talking about trauma-informed parenting and care today. Okay, so just to give you guys a little bit of background about me, again, my name is Marci. I got my bachelor's in psychology, and a minor in child development. And then I went on straight from that to get my master's in social work. I think I knew from a very young age that I wanted to be a clinician and that I wanted to work with children. So nothing really deterred me from that. I just kind of kept going and stayed on that path, and it felt like a good fit for me the whole way. So I'm proud to say that I'm an ECU alumni. I got my bachelor's and master's degree from East Carolina University. I'm originally from Little Washington, so not too far from Pitt County, Greenville, North Carolina, where I ended up going to school and kind of residing after staying in the Pitt County area. After I obtained my master's in social work, I did obtain my clinical license and became a licensed clinical social worker, as well as a licensed clinical addiction specialist. Because we're talking about trauma today, I have a big passion for trauma. I always have. I've worked mostly in foster care. That's where my experience really came from, was working with kids in the foster care system, and then later became the director over that department. So I have a really big passion for trauma and understanding trauma and how it affects not only the mind, but the body and the children that, we serve in the human services field. So through that experience, I saw that trauma was all around and wanted to do more and wanted to become credentialed as a trauma clinician. So I am a trauma certified clinician in two different evidence-based practices. One is called SITCAP, which is more like an art way to express like trauma and to work through it. And then the other one, which is more commonly known, is trauma-focused cognitive behavioral therapy. And I obtained that credential through a cohort at Duke. And still actively working with kids who have a trauma history in my private practice that I do in the evenings. So trauma is, really important to me, and I hope that you guys take something meaningful from this training. So yeah, I'm also a mom. This is my crazy little toddler, and I'm expecting another daughter in May. So I will have two crazy little girls, and I'm thrilled. But a little bit too about just like my passion and how I got here was really because of this dude right here. This is my brother. His name is Noah, and he is on the spectrum. So I have a really big passion also for children who are on the spectrum because of my brother and seeing him, just grow up over the years. I was 12 when he was born, and he was diagnosed with autism when he was 3 years old. So, it presented a lot of challenges to the family. And I think I was like, I want to learn more about this. I was very interested at a young age. Like, I want to learn more about autism, how I can help him and be a big sister to him, and how I can help, my parents. I saw that they were stressed. So he is a really big reason for my passion and kind of my why behind why I do what I do and why I love to just kind of give back to kids in general. But I am very excited to be here with everyone today. I'm going to try to be very mindful of the time. There's a lot to unpack with trauma, but I will try to do my best and make sure that everyone is out of here on time and that you're able to get your CEU for the day. Okay, moving forward, we're going to talk about some of the objectives. So hopefully these are the things that you'll take away once the training concludes. Hopefully we'll be able to define child trauma and describe how children may respond to different traumatic events. We're going to define resilience and describe how parents, caregivers, just consistent people in a child's life can promote resilience. We're going to explain the relevance of trauma to work of behavior analysts, and we're going to explain the commonalities between principles of trauma-informed care and ethics. And then we're also going to describe considerations for communicating with stakeholders about trauma. Like I mentioned earlier, there's no way we're going to be able to get through everything that I would like to get through when it comes to trauma and trauma-informed parenting and all the skills and all the things that it takes. But we'll be able to scratch the surface a little bit and get a good baseline. And hopefully you'll leave out of here with like a new perspective or even with some questions or just maybe even looking at things a little differently. There will be code words throughout the presentation since unfortunately I'm not able to do this live. I am going to include some code words so that we can ensure that you were in attendance today and stayed throughout the whole training. So just be aware of those. You will know what they are. It'll be pretty obvious when we get to it, and I'll make sure that I flag it and mention it. Okay. So let's start with, why is understanding trauma important? Like, why does this even matter? Who cares? Why do I need to know this? Probably the thoughts of a lot of people, like, oh, I don't usually have to work with children who have a trauma history, or I don't really interact with people who have a trauma history that we know of. So the National Center for PTSD does estimate that 60% of men and 50% of women have or will experience at least one traumatic event in their lifetime. This number gets larger for certain groups. So I referenced in the beginning that I worked with children in foster care. Almost every child who walked through that door had experienced at least one adverse childhood experience, because guess what? If you're in foster care, that's an adverse childhood experience. You were separated from a caregiver, whether you wanted to be or whether it was better for you or not. That's still a trauma, and you're being separated from someone that you knew your whole life. So they are one of those groups where those numbers tend to be higher, as well as ones that we would commonly think of, like first responders, military personnel, or even those escaping areas of violence. And according to the CDC, 61% of adults have experienced at least one adverse childhood experience, and 16% have experienced 4 or more. So adverse childhood experience is a screening tool that we commonly use in the mental health field, and it just targets different areas, like, have you experienced these things in your life? And some of those experiences are abuse, sexual abuse, neglect, caregiver substance use, parental separation, parental incarceration, etc., along with a lot of other things. So if you have experienced any of these things or checked yes, then you would have experienced, at least one adverse childhood experience. So I did a little more research when preparing for this webinar, because I wanted to include some perspectives of behavior analysts as well. And I may butcher his name, but I think it's Rajerman. He did a study with some colleagues and reported that there's a greater risk of trauma in children with intellectual and developmental disabilities. And he noted something that I thought was really interesting, that communication deficits, they're a core feature of children who have developmental disabilities, like children who are on the spectrum. So the fact that most trauma histories are reported verbally would tell us that there are probably clients who arrive at the doorstep of an ABA service ready to go with a trauma history that may remain unknown if they can't verbally report that to us. So we'll get into that a little more, but that is just a little bit about why understanding trauma is so important in the human services field in general. So here is a quote that I like to use, and that has been used in a lot of my trainings of trauma, and it's by Walt Whitman. So if we were in person, I would have someone volunteer to read this, but I'm going to go forth. So the quote is, "There was a child that went forth every day, and all that he looked upon became a part of him." Basically saying that everything that children experience becomes a fiber of their being. These experiences can include bad and confusing events, such as trauma, as well as really good experiences that adults share with them or that they share with their peers. So everything becomes a part of a child, whether it's good or bad. So I thought this quote was very relevant to this topic that we're going to be discussing today and looking a little more deeply into. So we're going to talk about the challenge, because it is a challenge. Caring for traumatized children or children who have a history of trauma can be very difficult. So as you know, making sense of like behaviors and reactions and attitudes of children can just leave parents and caregivers or even professionals feeling confused, frustrated, unappreciated, angry, and even helpless. So that's what we're going to talk about. And we're going to talk a little bit about solutions as well. So the solution to dealing with children who have a trauma history is trauma-informed parenting or trauma-informed care. So when you understand what trauma is and how it has affected your child or the children you work with, it becomes easier to communicate with your child, improve their behaviors and attitudes, get them the help they need. Maybe they need additional resources, and even reduce your own compassion fatigue. Secondary trauma is very real for a lot of caregivers and professionals working with children who have a trauma history. You would be a robot if you didn't take some of that stuff home with you or think about it or think about all the struggles that one child may have. So learning and looking through this lens can help you have better self-care practices as well. When you're more mindful, when you know something, you do something. So that's kind of, part of the solution that we'll be talking about a little bit. So we've said the word trauma probably 50 times already. I don't know if anyone's keeping count, but what does it mean? Like, what is trauma? So we're going to look at that. Like, how do you define trauma? And I want you to just think about it, because there's really no like wrong answer. It just depends. Like, something could be traumatic to someone else that may not be to me personally, but there are ways that we define it. So what makes something traumatic as opposed to maybe just stressful? So we're going to look at that a little more. So according to mental health experts, a traumatic event is different than the run-of-the-mill stressful or upsetting events in several ways. First, it's going to threaten the life or physical integrity of the child or someone critically important to the child, such as a parent, grandparent, sibling. Second, they may feel their body is out of control, and this may add to a children's feelings of helplessness and panic. For some people, they experience intense helplessness, fear, horror, terror. And third, the body reacts to this threat automatically with an increased heart rate, sometimes shaking, dizziness, faintness, rapid breathing, release of stress hormones like adrenaline and cortisol, and the loss of control of the bowel or bladder. So the physical responses to trauma can be terrifying in themselves, and feeling that your body is out of control, it only adds to a child's feelings of helplessness and panic. So the danger they may feel as if it's on the outside and the inside all at once, because trauma can have very physical effects as well. So that's why that trauma-informed care is so important. So like one little boy had said, my heart was beating so hard, I thought it was going to come out of my chest. And those can commonly be, mistaken as panic attacks, which can be a result of a trauma response. So that's how we're going to define trauma and an experience. These experiences that can happen to them as well as the physical responses. So there's different types of trauma, and we're going to talk about those next. So in school, we were always taught little t trauma and big T trauma. But for this purpose, we're going to use the correct terminology, which is acute trauma and then chronic trauma. So acute trauma is a single event that lasts for a limited time. And these are common things such as like a car accident, being bit by a dog, witnessing or being a victim of a school shooting, crime, or gang violence, going through a natural disaster like a tornado, seeing a loved one die, a physical or sexual assault that occurred on one occasion. But even during these brief events that are still classified as traumatic, children can go through amazing and bewildering number of thoughts and feelings, and even physical responses as they react to the danger and think of how they can find safety. Certain moments during the event, such as like a dog, if they're like baring its teeth or they see someone with a gun, that can stick in their mind and they can think the worst or the scariest, even if it's not. Children often gauge the seriousness of an event by a parent or another adult's reaction or response. So a good example was a little girl who had lived through a hurricane. So the worst part of it was seeing her mother cry because her mother was fearful, which as an adult, it can be hard when we're also experiencing emotions to not have our own emotional reactions to things. And how many people have not been through an acute trauma? I mean, that's like a car accident. Who hasn't been in a fender bender? Even if it's something mild, the next time you get in a car, are you not gripping your partner's arm like extra hard when you feel like they're getting too close to another car? Like that's a response, like our body has like a physiological response. So just being mindful of those things. I was bitten by a dog in college, and it was a really good friend's dog. Have had no issues with dogs, but after that happened, I'm now a little weary when a dog runs up to me. I'm like, oh, okay. It takes me a minute to know that that dog too is not going to nibble my foot off, because it did happen to me and it was very unexpected and random because I knew this dog, but it attack me. Something happened and it ripped the bottom of my foot, and it was to me a traumatic experience. I had to go to urgent care. I had to have a tetanus shot. They had to flush it. They had to glue it. It was just a mess. So a lot of people have experienced an acute trauma, and being mindful about how our body reacts to that is very important. And that's having that trauma informed lens that we'll talk about a little more as we move through the presentation. So there's chronic trauma as well, which is experiencing many traumatic events, often over a long period of time. Chronic trauma can mean reoccurring traumatic events of the same kind, such as physical or sexual abuse, or the experience may be different traumatic events, such as a child who's seen a violent fight between their parents, but then later gets hurt in a drive-by shooting and has to spend the weekends in hospital going under a ton of procedures. That's like complex trauma. You're going through multiple different events that are all traumatic, and they're happening through the course of your life. The effects of chronic trauma, they really build on each other. The brain and body of a child who has experienced chronic trauma for years may respond very differently to a scary event than a normal child would. Children who have experienced a series of traumas may become more overwhelmed by each event that follows, and are more convinced that the world is not a safe place. They have a harder time trusting people, a harder time finding a secure base. So those are often what we will see in children who have experienced chronic or complex trauma. So let's talk about how children respond to trauma. So long-term trauma can interfere with healthy development, and it can, and it will affect a child's ability to trust others, a sense of personal safety, their ability to manage their emotions, their ability to navigate and adjust to life's changes, and they'll also have physical and emotional response to stress based off their trauma history. And we're going to talk a little bit more about what we might see as professionals. So again, I can't fit all of what we might see, but I'm going to try to hit like at least the hot points. So a lot of people in human services, when we're working with kids, there's a lot of play involved. So there's traumatic play. So when playing, young children who've been through traumatic events, they may repeat all or part of the traumatic event. They may even take on the role of the abuser. Sometimes there's a lot of self-blame and putting the blame on themselves, if not trying to reenact how maybe the abuser act. Child different outcomes, make up different scenarios for their trauma, or get stuck on a particular moment or event. And there's other ways as well, like some kids, they truly cannot remember parts of their trauma or their experience, and that is repression, which is a coping skill that helps keep them safe. There's also on the other end of the spectrum where you're way too comfortable talking about it, like wrong place, wrong time. And a good example that I think of was there was a child that was in foster care, and she was at the dinner table with her foster parent, and they were at a family like gathering or birthday party for a family member, and she had been through a lot of chronic trauma, and during the dinner she just blurts out, my brother was murdered, and everyone at the table, turned to look at her. She was 6 years old, and she just overly went into detail about what she witnessed, and she had never met these people. This was her first time meeting her foster parents' extended family, and they were all in awe. They were very shocked and didn't even know what to say or how to respond. She felt overly comfortable talking about her trauma at the age of 6, and unfortunately she did witness her brother being murdered by her stepfather, and she was informing everyone at the table what she saw, and that her mother was incarcerated because her mother knew about it. So that's an example of wrong place, wrong time, but the foster parent responded really well and was able to kind of help her through that. So yeah, there's a lot of different things that we could see. So we're at a code word. So your first code word is traumatic play. So that's the first one, traumatic play. Okay, jot that down, take a picture, whatever you need to do. Okay, moving right along, we're going to talk about the role of resilience. This has resistance. I'm so sorry. Resilience. That is an error on my part. But resilience is great because there's great news. Kids are very resilient. They are able to bounce back from a lot of things, and just because they've experienced one or two traumatic events doesn't mean that's going to dictate the rest of their life. So resilience, to define it, is the ability to recover from traumatic events. Children who are resilient see themselves as safe, capable, and lovable. And this is achieved through structure and supports, which we're going to go into a little more detail here in a minute about how we can help our children become more resilient. So grow in resilience. So nothing, of course, is going to entirely wipe out the effects of trauma. It's never going to be like, oh, it never happened. Great. But research has shown that there are many, many factors in a child's life that can promote resilience. And some of those are having a strong, supportive relationship with a competent and caring adult, feeling a connection with a positive role model or mentor. This can be someone who's also gone through like painful experiences or survived, or someone the child aspires to be, or someone the child just has built a strong trust with. Um, if they feel like their talents and abilities are recognized and nourished, pro-social activities are great for kids. If there's something that they're particularly good at, if a parent or caregiver really hones in on that, they feel confident, they build self-concept and self-esteem through those types of activities. Feeling a sense of control over their own lives, feeling invested in a part of a larger community. That could be like in their neighborhood, faith-based groups, Boy Scouts, Girl Scouts, extended family. Some school-aged children or adolescents who have experienced trauma find that serving a cause can be healing. And as a parent or guardian or professional working with a child, you can play a really big role in helping your child develop resilience. I had a lot of kids who would tell me when we're working through trauma in therapy that they want to write a book. And a lot of trauma-focused cognitive behavioral therapy is that they either have to write out their trauma and make sense of it, or they can do it in an artful way. And a lot of the kids, they want to keep it because they're like, I want to publish this. Like, they're so proud. But part of the model is that you can't keep it. You have to destroy it in a meaningful way. So we've like burned it and had like a party, or we've cut it, shredded up, and then put it in like a memory box and like Mod Podged it, so it's like you can't tell what it says, but we made it into something beautiful. Like, they're really creative. These kids have great ideas. So, but they're like want to make meaning of it. They're like wanting to write about their life and their story, or be a speaker, a motivational speaker, and help people. So all of those things can help promote resilience in these children. I would ask if there were any questions at this point, but again, I'm gonna leave my email up so that you guys can email me. I know I'm covering a lot, so thank you for bearing with me. So we're going to switch gears just a little bit, and we're going to talk about trauma-informed care and ABA. Like, how does this apply to you? How does this make sense? This is great, Marci. This is awesome. But how does this make sense to the world of ABA or behavior analysts? So we're going to talk about that a little bit. We're going to look at these components together and think about, like, okay, well, how can trauma-informed principles play into ABA? There's been a growing acknowledgement of the importance of understanding the impacts of trauma on a lot of different therapeutic approaches across the human services field in general. But trauma in the field of ABA has become increasingly researched, is what I've found. I found some really good articles that I'll leave the resource page up. And if you want them sent to you, I have them. I can send those. But it is becoming more and more research on how to blend ABA principles with trauma-informed principles. So we're gonna again touch on it. We're not gonna get to all probably the parts that are, you know, all inclusive, but we'll get to a good place where hopefully you'll have a good understanding. So let's define how trauma-informed ABA, how it's operationally defined. So it's recognizing someone's history, their lived experience through their own eyes, and mistreatment or microaggressions, and how they have a direct impact on how one behaves. It's viewing someone through the context of who they are in the world and how they self-identify, or how they are identified or labeled by others. For example, a history of abuse, crisis event, significant illness or injury, neglect, mistreatment, prejudice, misjudgment, social rejection, they're all traumatic events that can influence how any intervention in therapy is applied or carried out. So that's what we're going to look at a little more. And we're going to do this through a trauma-informed lens. So we're going to think deeply about some of these things. And Tamika Meadows, she is the one who I got a lot of this information from, and I thought she posed some really great questions. And she's a BCBA as well. So we're going to just kind of go through this, you know, together, and hopefully challenge you just to think about it a little more deeply. So how many of you have had kids on your caseload that you've worked with who've been kicked out of school or asked to leave multiple daycares or even preschool settings? So she posed the questions like, how did this affect them? What would it feel like to be in a setting where you felt excluded, not wanted, judged, or your needs weren't met? What kind of interventions and consequences to problem behavior were attempted before the facility realized they cannot meet the child's needs? How did the failed attempts at consequences make them feel? And she added that you can't even ask most of your clients these questions, because even if they can communicate by speaking, they may not have the vocabulary, cognitive understanding, or desire or motivation to even answer these kind of questions. You can, of course, consult a caregiver or parent, and they can speak on the child's traumatic experiences, but it's not going to have the same effect as if you were able to get that information directly from the child and their perspective of what it was like. So that is having that trauma-informed lens when we're thinking about these questions a little more deeply. And that brings me to your second code word, which is trauma-informed lens. So remember that one. I'll leave it up here for a second, but this is the second code word, and it's trauma-informed lens. Okay, perfect. Okay, so now we're going to touch a little bit on ethics and trauma-informed care. So of course, part of, I think, multiple people in human services field code of ethics is designing interventions that respect the client's dignity, autonomy, choice, and preferences. I think that's just pretty standard across the board, that's something we want to do. But some questions that were brought up to consider regarding ethics. And I'm just going to read this part from you that she had brought up that I thought was good to mention and relevant to what we were talking about today. So Ms. Meadows said, if my client hates washing dishes, is it unethical to utilize reinforcement to teach them this skill because their parents want them to wash dishes? If my client has a meltdown in a public space, should I immediately take them out to respect their dignity in the moment, or is that reinforcing escape behaviors? If my client is non-compliant, is physical prompting necessary? How do I respond during a session when my client revokes their assent? What about a client who is older, able to communicate, and tells me they don't want to receive ABA therapy anymore? How should you respond? How do you select treatment goals for a client who has no means to communicate? How do you make sure that you're embedding client choice? Is it ethical to create a behavior plan for stereotyping? What about teaching play skills? Is it ethical or not? So that was a question that she posed. And I was like, interesting. So there is no right or wrong answer, right? Because one answer may go a certain way for one child and it may be completely different for another child, who, especially if it's a child with a trauma history. So let's just say client B has a history of trauma and school refusal and aversion to authority figures or past experiences with maybe a low quality ABA provider. The answers to the questions that we just discussed or that I just read out loud would be very different than if we were answering those questions for client A who has no trauma history. But this is a good thing because this is how it should be, right? It shouldn't be the universal answer across the board, because with intervention plans, they should look quite different from one person to the next. That's what we want: individualized plans, person-centered focus. That's the whole point that I think Ms. Meadows was trying to make in her article. So this also goes to show, like, just the training, like, so ignoring behaviors can be super effective, right? And we were always taught in my trauma informed trainings, especially TIPS MAP, which is a trauma informed curriculum that foster parents go through to be licensed. We talk about this, and the trainers talked about it, which I thought was funny because it is true. Ignoring behavior can be very, very effective. But there's a caveat to it, is that it's going to get a lot worse before it gets better. So are you strong enough to handle the worst before the better? That's a serious question. And they asked us that. And for me personally, I was like, no, I cannot. When my toddler is throwing a tantrum, I can ignore it, but for so long. And then finally I'm going to say something, and then I'm reinforcing the behavior. So you just have to know that about yourself. Can you do that? But then two, would we ignore behavior for a kid who has a trauma history of abandonment and neglect? Is that further contributing to their trauma? And an example I thought of when I was thinking about this after reading these articles was, I worked with a client. He was 12, and he was often physically abused, definitely neglected, isolated. He would be put in his room for really hours upon hours, and these just really strict and harsh punishments. Like food delivered like at the door, like, here's your food for the evening, don't come out. So he had found something in his room and set his curtains on fire. And that was a super negative behavior that is not something we desire. We don't want anyone setting their curtains on fire. But because he was neglected and ignored so much, that was a way that he could get his parents' attention. Because guess what? He had to come out of that room because it was in a safety concern because the curtains were on fire. Parents were so mad. He went to a psychiatric facility because of that incident. But when you talk to him, we're like, what was going on? Like, what happened with that? After we built a very, very strong rapport, he was like, I wanted to get out of my room. There was no malicious intent. He did not want to burn down the house. He was like, I even had like I had collected water that they had given me and collected about a gallon. I was gonna put it out. Like, he had a plan. But because they were ignored for so long, nothing, the kicking, the screaming, they were good at ignoring. They did great at it. He was like, I gotta up the ante. And some kids will who got that trauma response. They will go to some extremes to get your attention if you're ignoring them. So we can see that sometimes in kids who have a trauma history of, abuse and neglect specifically. Um, Rogerman in the article had stated that sometimes a hands-off approach for victims of physical abuse is ethically the way to go, which I mean, I think that's up for debate discussion because sometimes, at what point does it become a safety concern? And it can be difficult, but you could see that point of view too. Like if someone has a history of being physically abused by a parent or caregiver or, a loved one, if we have to do any type of restraint, how is that going to contribute to their trauma history? It's just something to think about, and some of the points that were kind of outlined and just helping you kind of think things from a different perspective when I was doing the research. So hopefully that just got your wheels turning a little bit and just kind of thinking about things from a different lens, or even maybe from a different way, and maybe seeing it another way, which that's fun too. But I want to build on that because I feel like I've talked and talked, but I did find a short little YouTube video that I think does a good job summarizing the things we've already covered and discussed. I think it's about 4 minutes long, so I'm gonna see if I can click on it, if you guys can see it. Hopefully hear it. For whatever reason, if this does not work and you're like, Marcy, I can't even hear it, just shoot me an email. I'd be glad to attach the link again for you via email, but we are gonna give it a go.
My favorite babysitter is Annalisa. She's pretty good. She's like my grandma. She says, Hola, ¿cómo estás? She plays with me. She helps you feel better. Bugs and insects are healthy for you. Amelia took us to the beach. She teaches me some gymnastics. We like color. We draw flowers and then we go skateboarding.
From babies.
Hi, my name is Mae Wilburn, and I'm a board-certified behavior analyst with Brett Sanovi and Associates. In this video, I'll be talking about trauma-informed care and applied behavior analysis. The ethics codes for behavior analysts that'll be covered in this video are 1.05, practicing within scope of competence, 2.15, minimizing risk of behavior change interventions. Trauma involves exposure to an event or series of events that adversely affects functioning and well-being. The adverse childhood experience refers to abuse and neglect, including exposure to domestic violence, substance abuse by a primary caregiver, or divorce. According to the Centers for Disease Control and Prevention, 61% of adults have experienced at least one adverse childhood experience. Children and adolescents in foster care or residential care and individuals with developmental disabilities are more likely to experience potentially traumatic events than the general population. Those who've experienced traumatic events may require trauma-specific services, which are individualized clinical interventions designed to directly address trauma-related symptoms. So what is trauma-informed? Being trauma-informed means to know the history of past and current abuse in the life of the client with whom one is working, and to use that understanding to design service systems that accommodate the vulnerability of trauma survivors and allow services to be delivered in a way that will facilitate consumer participation. The goal of trauma-informed care, then, refers more broadly to a universal approach taken by practitioners to appropriately support and avoid re-traumatizing clients who may have experienced traumatic events. An example of a trauma-informed treatment recommendation is considering a client's experiences. If the client has had a history of neglect and their problem behavior has been determined to be maintained by attention, rather than focusing on immediate contingencies such as extinction, the focus should be on skill building to teach appropriate attention-seeking behaviors. Another example is avoiding physical management for a client who's had a history of physical abuse. The effect of experienced traumatic events is generally conceptualized as an internal response to an adverse external event. In other words, how someone reacts anytime after a traumatic event has occurred. Although the trauma might have initially functioned as a punisher for a particular class of behaviors, like a child being spanked for making a mess, traumatic events can influence subsequent experiences. A barrier to discussing trauma in behavior analysis is that behavior analytic practice is focused on current contingencies, not how past events are impacting internal responses. In the Roger Marman et al. Article, they discussed how a possible framework to incorporate trauma-informed care into behavior analysis. These include acknowledging trauma and its potential impact, such as examining the current environment to assess if there are any similarities to the environment in which trauma experiences occurred, to determine if the environment may exert control over trauma-related responses. The second is ensuring safety and trust. These are difficult to provide an operational definition, but it involves establishing consistent routines and schedules of reinforcement. The third is promoting choice and shared governance, which allows the client to gain or regain a sense of control of their situation. And the fourth is emphasizing skill building. This puts an emphasis on differential reinforcement of alternative behaviors as opposed to differential reinforcement of other behaviors, non-contingent reinforcement, or punishment to uphold tenets of trauma-informed care and avoid re-traumatizing the individual. Thank you so much for watching. Please subscribe to our YouTube channel and to disseminate the science. Share this video.
Awesome. So I hope that that worked okay and that I did not completely mess anything up and that you were able to see it. And again, not the best with technology. I'm young, but I'm just not that great. So if for some reason you missed the whole thing and didn't see it, let me know. And I can definitely get the link, but hopefully you were able to hear it. And if not, and I just wasted 4 of your minutes, I do apologize. But I thought that that video was really helpful, and she even referenced some of the articles that I saw, and just how that trauma-informed care and approach is starting to be more incorporated into ABA principles, and how a lot of behavior analysts are trying to incorporate some of those approaches into their practice, into their care that they give, children and families. So I thought that that was a good little video that was kind of like a little summary. But yeah. So we will carry on. So I wanted to talk a little bit about collaboration. That's really important when working with kids with trauma histories, especially if they have a history of complex trauma. Like, you're going to want to consult with the provider, the trauma-informed specialist. A lot of kids will identify their clinician who is doing trauma-informed care and practices with them as a secure base and someone that's like a safe haven. So they may have strategies and techniques that work well and things that they're doing in their treatment that may be helpful in ABA, and vice versa. You guys may have some very helpful tips for that clinician as well, and the family, and just having that collaborative approach can be very meaningful and very helpful. Of course, like collaborating with parents, caregivers, teachers, or other professionals serving the child. We always say parents are the experts on their children. They know the ins and outs, but again, it's not the same as a child who can tell you about their trauma history, which could be a part of the challenge with the population that, most behavior analysts probably serve. So just kind of that collaborative approach, again, is just very, very helpful and meaningful. Screening tools with clients and parents, collecting the data, like providing that adverse childhood experience. It's a super quick questionnaire to give out to just kind of see, like, have they experienced any of these things? There's a lot of other screening tools that could possibly be incorporated too. If they are working with another provider, obtaining that consent for release. Do they have a biopsychosocial assessment completed from a mental health provider? What are their goals? What are they working on in therapy? What does their treatment plan look like from the mental health perspective, and how those two things can kind of merge? I think if they could do that, treatment could be beautiful from all areas and all aspects, which I think just dynamically a lot of people are moving towards that more collaborative approach. Primary care providers are connecting with clinicians. Clinicians are connecting with psychiatric providers, we're medication management. And I think if everyone is on one accord and talking about their treatments, then I think that is only helping the child and the family that much more. So that collaboration is really important. Stakeholders, LME, MCOs, insurances, you can receive dual services as long as there's medical necessity for both. That's usually not an issue. Sometimes an early periodic screening diagnostic tool is needed to be signed off on for a doctor, kind of like a service order saying, hey, both of these things are medically necessary. But a lot of times those two things are okay in conjoint. There's two specialists, a trauma-informed specialist and an ABA provider, or let's say a psychiatric provider and, mental health provider, like all of those things are their specialties. And a lot of stakeholders and commercial insurances will approve those things as long as you can back up the medical necessity part. Okay, so part of some of the articles that I saw was links and just resources in general for any behavior analyst or anyone in general who's just interested in learning more about incorporating trauma-informed care into ABA principles. So this is the site. I'll leave this up for just a second for everyone to see, but I can again send this via email if you would like it. It's just a really good resource of different blogs, different articles, different approaches, different thoughts, videos of how you can incorporate that trauma-informed lens into ABA practice, because it can happen. And like we've said, it's been referenced and it's being researched more and more, because you can hardly do work today without thinking about trauma and what these kiddos have been through, because like we said earlier, just having separated or divorced parents, that's an adverse childhood experience, according to research. So we just, being more mindful of those things, I think that we're definitely heading in the right direction. So I'll leave this. If you guys are interested, you can jot this down, or again, I can email it. And these are my resources that I had referenced several times throughout the presentation. So if you're interested in these articles or these blogs or these websites, I can definitely get them to you. Just let me know. And then, of course, I know I wasn't with you guys live, but I do so appreciate it. And I'm sorry, I feel like I've just been talking on a computer, which I have. But I'm available for any questions. Like I said, I'm very, very passionate about this. I love trauma, and I love, just diving in and hearing the different perspectives and, how other professionals feel, if they've incorporated some of the things, if not, if they're interested, if they're not. So all the things. So if you have any questions or anything that you jotted down or concern, thought, anything like that, I'm more than open to doing that. So this is my email address, and this would be the best email to send me questions. And again, I do apologize that I wasn't here with you guys to do this live, but I do appreciate everyone's time, and I hope that you learned something helpful or meaningful, or even something that made you think a little deeper. And I, again, just appreciate it. And again, I'm Marci, and this is my email if you have any questions. And I hope that everyone has a great rest of their day.